If you're watching this video, it's because you believe that your breast implants are too large. And this is something that doesn't occur all that commonly, but every once in a while I have somebody, a patient who comes to YPS who says that their breast implants are just too big and they want to downsize. And if that is you, that is not a problem. We're happy to do that because, if you feel like your breasts are too large, we can always make them smaller. So, if you're thinking about downsizing, the big question that you need to ask yourself is, do you want to remove the implants entirely or just downsize? Because they're two very different things. And so some people come in, they say, look, I'm just done with implants. I just want to get them taken out. I don't care that my breasts are going to look flatter afterwards and smaller. Let's just get rid of them. Other people say they're just too big, but I still want implants. Let's just make them smaller. So these are two things that we treat them very differently. And let's start by talking about complete removal of implants or an explantation. Okay? So, and those people who say, look, I just don't want my implants, no problem, we can always remove them. And typically the surgery is not that difficult. It's done under a general anesthetic. And typically I'll make an incision through your previous scar, either below the breast or around the areola. And then we take the implants out. Now, if your implants are soft and the scar tissue around it, and every implant has scar tissue around it, it's just the majority of them are soft. If it's a soft scar tissue that's not thick, then we don't really have to do a lot with it. Okay. If, however, the scar tissue is thick, if you have a capsular contracture, then we may want to remove that scar tissue, which would be a bit more surgery. Okay. But if it's just primarily the breasts are soft, then we can take that implant out. And then usually what I'll do is try to create some inflammation of the scar tissue left over to allow that scar tissue to heal together and the pocket that the implant was in to close up on its own. And so we'll make multiple cuts into the scar tissue to create some inflammation to allow the tissue to close off on itself. We put a little drain in each breast, and that drain stays in for about 6 days, and then we suture the incision shut. The surgery itself, if it's just a pure explantation without removal of scar tissue, it takes probably about an hour, maybe an hour and 15 minutes. And you do have the drain on each side afterwards. You head over to the recovery room for about a half hour to an hour, and then you head home. If, however, we need to do a capsulectomy, if you've got excess scar tissue that needs to be removed as well, then that does increase the surgery time from about an hour and 15 minutes to probably about 2 to 2.5 hours. Because it does take time to remove that scar tissue. You still have a drainage to put in, and the incision isn't any longer if you have the scar tissue removed. And then once again, you head over to the recovery room and you're there for about a half hour to an hour before you head home. Now with either of these surgeries, the amount of pain is pretty minimal. Most people take, if any, pain pills, just a few for the first couple days, and usually that's all that they need. You come back at day 6 to our office and we take the drainage tubes out. You can start exercising in about 3 weeks, and it can take a few months for all the swelling to go away. Now there are risks of the surgery, and really the first thing I need to let you know is how's it going to look if you take your implants out. Your breasts basically are going to look flatter. Okay, that's what you want to look at. They're going to look flatter, and in some cases you lose almost all of the roundness and the fullness of your breasts, and they just look like flat kind of pancakes. There's no way around it if you're just taking them out, but that's what can happen. Some people ask, am I going to need a lift? Are my breasts going to droop if I take the implants out? And technically, they're not going to droop any lower than they already are. They're just going to deflate and look like you've had potentially some excess skin. And it really all comes down to how big your implants are and how much breast tissue that you have left. So the final result is variable based off of the patient, and in a face-to-face consultation, I can show you by kind of pinching your breasts, by finding out what size your implants are. We can try to give you an idea of what you can get out of it. But to put it generally, your breasts are going to look flatter. They may feel like you have some excess skin, but they're not going to droop any lower. So they're not going to go from being on your chest down to your belly button if you take implants out. So what are the risks of it? Well, obviously, cosmetically, you may not like it. That's the first thing. There's always risks of bleeding and infection with any type of surgery. Those risks are fairly small. There's risks of fluid collections afterwards. There's risks that you're just not going to like it. It is a big change for some women to have their implants taken out. And we will go over other types of potential risks, a complete list of them at the time of your preoperative visit. So explantation, sometimes we'll do a breast lift with it, okay? And so if you don't have a lot of droopiness, if you've got a small implant, then sometimes we can just remove the implant and not need to do a lift. We put the drain in and you're good. Other times, like with this patient, she's got quite droopy breasts starting out. She wants to take the implants out, and then at that point it would make sense to do a lift because she's so droopy. In that situation, we remove the implants, maybe do a capsulectomy, and then we do a lift afterwards. And this is what's called a skin-only lift. And if you look at the section for breast lift with implants, I go over that quite a bit. Anyways, we take the excess skin out, do the lift. It typically will create a scar that extends all the way around your areola, vertically down and horizontally underneath your breast. There is a little drainage tube that does stay in once again for 6 days. A little more pain with this surgery just because it's a bit of a longer surgery. Typically, if you're doing a lift with explantation without the capsulectomy, you're probably looking at about a 3-hour surgery. If you add the capsulectomy to it, it could be closer to 4, even 4.5. It is a general anesthesia, and then you head home once again about a half hour to an hour after the surgery is completed. For the recovery, you come back in a week for that drainage tube to be removed. We switch your stereo strips at that time. There's little tapes over your incisions that we change for you. You can start exercising at 3 weeks, and it does take anywhere from 4 to 6 months for all the swelling to go away. And during your healing time, it's going to take up to a year, sometimes longer, for your breast to kind of reshape. Because quite often after the breast lift, your breasts are going to look a little funny. They're going to look boxy, meaning kind of flat on the bottom, a little bit wide, and round up top. You can even see a little bit of a boxy shape with this picture on the right. But with time, that boxiness goes away and things settle themselves out. So a lift is done when you've got a lot of loose skin, and even more done if you have loose skin with a combination of a big implant that is removed. Well, what if you want to downsize your implants? What if you don't want to remove them, you just want to go smaller? Well, the first question is what size do you have? So extremely important. If you're going to come in and you want to downsize your implants, and even if you want to remove them, bring in your implant information, okay? Bring in what you have from home, your implant card, because we want to know what size you have. Because if you come in, you say, hey, I want to downsize my implants, and the first question I'm going to ask you is what size do you have? And if you don't have your implant information, then we can't go all that far with the consultation. It's going to be wasting your time and mine because I don't know what size you have implant-wise, and I can't counsel you on what size to go with if we don't know what you have. So you want to bring your implant information with you to the consultation. If you don't have it at home, call the plastic surgeon who performed your surgery and get it from him or her. If they don't have it, then try to contact the location that you had the surgery performed at and see if they may have that information. And if they don't have it, if it's been way too long, we can still do your consultation. But I tell you, without that implant information, there's a lot of guessing that we're going to do. And a lot of times that guessing is not very accurate. And so it's always best to have as much information as possible the moment you walk in the door for your face-to-face consultation. So the first question, what size do you have? The second question will be, what size do you want to be? How much smaller do you want to be? Okay, because those are things that really are up to you, is what size you want to be afterwards. And the surgery basically is an implant exchange with or without a breast lift. So an implant exchange can be a very simple operation. Okay, if we know what size you have and you want to downsize, it can be as simple as making an incision underneath each breast, taking the old implant out, putting a new one in, and then stitching it shut. That can take about 45 minutes, maybe even less sometimes, and a very, very simple recovery. Sometimes we'll combine it with the breast lift. If you go a lot smaller and or if you've got a lot of extra skin, then we may need to combine it with the breast lift. That will increase the surgery time to probably upwards of 3 hours, maybe even more. Both of these are not considered painful operations, especially an implant exchange. You won't take any pain pills most likely after an implant exchange. Recovery is very simple, no working out for a couple of weeks. You may have a little swelling, but even usually very little swelling with that. If we do a lift, that's a bit of a different story. It's a longer surgery. You may take some pain pills afterwards, but probably off pain pills within just a few days. You come back at a week, we change all the tapes at a week, 3 weeks to exercise, 4 to 6 months for all the swelling to go away. So with the breast lift, it does take a bit longer to heal. With the implant exchange, you usually can go back to work within a week without a problem. When you do a breast lift, probably between 1 to 2 weeks on average, depending on the type of job that you have. Now the risks with this, we always start off with bleeding and infection, although those risks are pretty small. Main risk is capsular contracture. So every time you put a new implant into the body may react differently to it. It may create excess scar tissue that can cause a breast to look and feel hard, firm, and even painful. That's a capsular contracture. And so you have to weigh the benefits of getting smaller with the potential risks of a capsular contracture. And so that's why if you say, hey, look, I just want to be a tiny bit smaller, I usually don't recommend going to surgery, because the last thing you want to do is have a very small amount of benefit, but your risk is the same, which could be fairly high with the capsular contracture. And the risk of capsular contracture is anywhere between 2 to 4% in general. You just never know. So that's one, the kind of introductory information about downsizing your breast implants. And so we can do the implant exchange with or without the breast lift. One thing I tell patients is if you're going to downsize, and this is why it's important to know what you have, you want to start by downsizing your implant by at least 20%. Okay, so for example, if you have a 400 cc implant, 20% of that is about 80 cc's. Because implants come in 25 cc increments, the smallest drop that you want to do with a noticeable size difference is down to 325. So if you have a 400 and you downsize to 375, you probably won't tell any difference. You have a 400, you downsize to 350, you may not be able to tell that's any different. 325, usually people can start telling at that point that there is a definite change in the size. So that's just my initial rule, is downsize by 20%, just to give you an idea of where you go. Okay, so we talked about the implant exchange with or without the breast lift. Here is an example of a picture of somebody who had the implant exchange with a lift, and you can see the scars of a lift. If you're interested in learning more about breast lifts, I encourage you to look at that. Go to the section on this pre-consultation entitled My Breasts Are Droopy, and we'll go over all the scars of the breast lift and how the surgery works. So if your breasts are too large, the first thing you want to determine is, do you want to get rid of your implants or do you want to downsize? And definitely bring your implant information with you to a face-to-face consultation, because there's not a lot we can do without it. And so we'll go over that information together, and we can pick your size together, whether you want to remove them or not, and then also by looking at what's going on, decide whether you need a lift or not. I hope this has been very helpful for you, and I look forward to seeing you in a face-to-face consultation. Thank you.